We're going to show a quick case of a capsular release. This is a pleasant 42-year-old female who injured her arm in a fall. She actually had a mid-shaft humerus fracture that was fixed surgically. You can see here she does have evidence of a partial rotator cuff tear, a partial articular side of rotator cuff tear. And this was confirmed on MRI, as was the diagnosis both clinically and via imaging of adhesive capsulitis. You can see there her superior labrum was quite inflamed, and now we're seeing thick bands of scar tissue in her anterior and anterior inferior capsulolabral ligamentous tissue. She had decreased external rotation both at her side as well as in abduction, and so we're going to perform an anterior and an anterior inferior capsular release. We use a combination of arthroscopic either biters or something sharper like a capsular punch, and then once we've released the capsular tissue, we also perform a capsulectomy. So it's not enough just to perform a capsulotomy. You actually want to excise the scarred capsule to prevent any reformation. Now we're viewing actually from the anterior superior cannula and using an Arthrocare wand to complete our posterior capsular release. She actually lacked internal rotation in abduction. She had approximately 20 degrees of internal rotation, and she had trouble getting her hand above T10, and so we also performed a posterior release.